Our next speaker is Laureate Professor Peter Doherty. Peter shared the 1996 Nobel Medicine Prize with Swiss colleague Rolf Zinkernagel for their discoveries about transplantation and killer T-cell mediated immunity. And that work is currently being translated into new cancer treatments. Peter is still active in research at the Peter Doherty Institute at the University of Melbourne and has written widely, including about climate change and health. Over to you, Laureate Professor Peter Doherty. Thank you.
Well, thank you very much. I'll be fairly brief. I've been totally obsessed with COVID communication over the last 20 months, so I haven't been thinking as clearly about climate change as I might have been. But it's since I found myself on the public stage after the Nobel Prize in 1996, I've been trying to do advocacy for action on climate change. I must say, looking at what happened in COP26 and our country's part in that, I've been substantially unsuccessful, as most of us have. Now, climate change, of course, many people think of it as a problem in the physical sciences because it's the physical scientists who tell us what's happening and how it works and point to the dangers and what the likely outcomes are. But of course, it's the biological scientists like us, right across the spectrum, from marine biology to food sustainability to healthcare systems, who are looking at the consequences of climate change. When the geologists, for instance, tell us, well, these things have happened lots of times through evolutionary history, they kind of neglect to mention that we've never had 8 billion people on the planet before, and that we don't really care about what happens to the cockroaches and the rocks, which may be their obsession. So climate change and infection. The problem with all issues, as you try to talk to people, legislators or administrators or whatever, about health and climate change, is that it's so broad, so multifactorial, because everything that affects the viability of our food sustainability, of the ecosystems that sustain that, if they be bees and pollinators and so forth, impacts eventually on human health. So the issue of human health, climate change, and infection. Thinking from the pandemic's perspective, the interactive effects, of course, are food stress, particularly in third world countries, where you're getting loss of forest cover, people moving more and more into forested areas and harvesting wildlife and coming in close contact with wildlife. That's how we think HIV/AIDS came across. And of course, now we're seeing this CoV-2, we're seeing a virus that's sustained in bats, fruit insectivorous bats, coming across into human beings. And we've seen 2 of these viruses come across in the 21st century, the SARS virus in 2002, 2003, and now CoV-2. And we also have another 3 coronaviruses, new ones, that came across since the year 2000. And these are spreading across the planet. The Middle Eastern one is kind of localized. We think it goes from bats to camels to humans. The original SARS went from bats to a small animal called a civet cat to humans. And this one, we're not quite sure, but we think it probably came, again, through a live animal market in China. So there's an enormous increase in risk, partly due to now people who live in areas where you have these live animal markets that bring wild animals in contact with humans, getting on airplanes a lot and flying across the planet. So how does climate change impact on that? Well, firstly, affecting food sustainability and increasing the harvesting of animal species and bringing people into closer contact with animals in the wild. And then, of course, the other practices that change, for instance, where you use, you're tapping sap from trees that bats also feed off. If human beings collect that sap as a human product, bats contaminate it, then of course that also contributes to the spread of disease. On the other hand, from the climate change perspective, bats are extremely sensitive to extreme heat. And we've seen flying foxes drop from the trees in large numbers in Australia. So in one sense, as the world warms, we at less threat from bats and transmitting viruses into humans. Now that, of course, would have another catastrophic situation associated with it because bats are very important pollinators. So we again have to interface with this complexity, with this One Health approach, as we've just heard about, that it goes right through systems. So then we've got the issue of mosquito-borne diseases. Clearly, mosquito-borne infections, depending on what the mosquito is, are more in the tropical areas. Zika virus, for instance, was rattling around in the Pacific for a long time before we saw it come into South America, but it didn't come down into Australia. Malaria doesn't come down into Australia. Dengue occasionally does. So as the world warms, we would expect to see mosquito-borne infections move further away from the equator, which would mean further south in Australia, and we would expect to see them also move further up into higher areas. Now, that's very important. For instance, there's a situation in Hawaii where an avian malaria kills off mosquito-transmitted. It kills off a bird species called the honeycreepers. The honeycreepers only survive above the mosquito line. So as the place warms and the mosquito line moves further up the mountain, then you start to see them dying above that line. The same thing if you look at East Africa, for instance. There's malaria in the coast of Mombasa and Kenya, and it's not normally up in the area around Nairobi and so forth, where you've got a plateau, which is cooler. So we will see infections move further up the hills into the cooler areas. That's not an enormous threat for us. We are a wealthy country. We practice mosquito control. We do have Ross River virus as a problem, of course, which has moved right across the country. And we've never had dengue firmly establish itself in Australia, or malaria. Part of the reason for that is, of course, we don't have large human populations in the north. So as climate change increases, I wonder how long living in those areas is going to be viable, and whether we're going to see a decrease in population in the north rather than an increase in population. And there are other ways of handling mosquitoes that are quite innovative. Scott O'Neill, for instance, started this whole business of infecting the mosquitoes with Wolbachia, so they'll no longer replicate. So these are a couple of situations where the climate change infection correlation is not necessarily straightforward. There are pluses and minuses, though the minuses reflect other horrible consequences. The other obvious one is, of course, with flooding, where you have massive flooding that overwhelms water and sanitation systems, difficulty in getting clean water, contamination of water systems. And in general, there's a whole problem of contamination of water systems in poorer countries. Again, in countries like ours, we've seen this happening. We've seen it happening, for instance, Louisiana, with the big floods there, New Orleans a while back. We've seen it happening in places here as well. But we're generally equipped to handle that. So it's not the enormous threat that it related directly to infection. Then, of course, infection, if you've got a respiratory infection, you're in an environment which is extremely hot. You don't have access to enough fresh water. You're at much greater risk. So the sustainability of our buildings, which is so important as we think about this, is also of major importance when we think about how infection, climate change, and everything come together in our health, with heat actually exacerbating the consequences of some types of infection. So again, and even in the Australian context, where it seems so difficult for us to tackle the cause end, the fossil fuel end, we could be doing an enormous amount at that end, on the sustainability end, building more climate resilient buildings, making sure our hospitals are more climate resilient and all the rest. So when it comes to infection and climate change, it's not a straightforward equation. It's not really, though people tend to focus on it, it's not really, to my mind, the primary thing we're concerned about. We're concerned with all the things that contribute to this interactive ecosystem and system of events. And there is also obviously an enormous need here for much more public education on this issue and on the complexity of these systems, which to many, I think, one of the problems I think that some politicians have, some people in business have, is they get to where they are by not dealing with complexity, by brushing it aside. And this is a massively complex, interactive problem. When I look back to Tony McMichael, for instance, who wrote that great book on human health and climate change and left us somewhat too soon, I reflect that Tony's field was lead poisoning initially. He studied lead poisoning, the epidemiology of lead poisoning. And lead poisoning is progressive, cumulative, inexorable. And that's how I see climate change: progressive, cumulative, inexorable. And if we're not going to act, we're in real trouble.
Wow, thank you so much, Peter Doherty. Wise words, and thank you so much for explaining the huge interconnectedness and complexity of this issue, and it is a multi-system issue. Thank you so much, and we look forward to discussion.